are a first responder trained in basic life support. You are visiting a daycare center and see an infant struggling to breathe. The attendant states that the child is 6 months old. 1. Your first action is to A. Do a finger sweep of the baby's mouth. B. Perform 5 back slaps. C. Feel for a pulse. D. Perform abdominal thrusts. Correct answer, B. Perform 5 back slaps. First aid for choking infant is first to do back slaps. Never do a blind finger sweep of the child's mouth. Doing a blind finger sweep may force the object further into the windpipe. The child is struggling and she has a pulse. 2. The responder should do back slaps to the infant. A. Between the infant's scapulae. B. In the middle of the back. C. Directly above the infant's buttocks. D. On the buttocks. Correct answer, A. Between the scapulae. The other positions are too low to be effective. You deliver 5 back slaps. Although the infant is still awake, she continues to choke. 3. According to the American Heart Association, the next step you should take is to A. Begin CPR. B. Go to a phone to call EMS. C. Turn the infant face up and deliver 5 chest thrusts. D. Begin rescue breathing. Correct answer, C. Turn the infant face up across your knee and deliver 5 chest thrusts. To deliver effective chest thrusts, you should A. Place 2 fingers of your hand below the navel. B. Place 2 fingers of your hand in the center of the chest, just below the nipple line. C. Place the heel of your hand below the navel. D. Place the heel of your hand in the center of the chest, just below the nipple line. Correct answer, B. Place 2 fingers of your hand in the center of the chest just below the nipple line. This position allows you to push into the infant's chest to expel the food. 5. The correct depth of compression during the chest thrusts is A. 1/4 the infant's anterior posterior chest diameter. B. 1/2 the infant's anterior posterior chest diameter. C. 1/3 the infant's anterior posterior chest diameter. D. 2 inches. Correct answer, C. 1/3 the infant's anterior posterior chest diameter. You look in her mouth and see nothing, but the infant is still kicking. 6. The next action is to A. Begin CPR. B. Do abdominal thrusts on the floor. C. Flip the child onto her stomach and give back slaps. D. Attempt to give 2 rescue breaths. Correct answer, C. Suddenly, the child becomes limp on your lap. You look in her mouth but do not see anything. 7. You should A. Place the child on the floor and give 30 chest compressions. B. Do a finger sweep to ensure there is nothing in the infant's mouth. C. Roll the victim over and administer 5 back blows. D. Continue rescue breathing. Correct answer, A. Place the child on the floor and give 30 chest compressions. This action may force the foreign body out of the child's airways. You open the child's mouth and see a small toy on the tongue. 8. You should: A. Continue chest compressions. B. Continue rescue breathing. C. Administer 5 back slaps. D. Reach in and remove the toy. Correct answer: D. Reach in the child's mouth and remove the toy. Since it is on the child's tongue, it should be reachable. Just be careful not to push the toy further back in the child's mouth. EMS arrives a few seconds later to take over treatment and transport the victim to the hospital.